Great, thank you. So glad to be here virtually. So today I will be talking a little bit about my dissertation project, which is divided into two parts: archival methods and ethnographic methods. So basically, what I'm trying to understand is how young menstruating students of grades 9 to 12 in Karachi, Pakistan, are making meaning of the menstrual taboo. And I'm theorizing that the menstrual taboo is, which is operating presently in Pakistan, is a colonial project. Next slide, please. With the help of my archival research findings, which is basically the focus of my presentation for today, I'm trying to position colonial reproductive healthcare, colonial medical education, and colonial scientific research as knowledge production systems, which have potentially influenced and impacted the modern day understanding of menstruation as a taboo in Pakistan. The menstrual taboo abides by the ideals of concealment of bodily fluids, which matches the Victorian rhetoric on womanhood and respectability. For instance, the hypermedicalization of childbirth is an example of the impact of colonial reproductive healthcare, which has sustained its influence in the current era as well. Many British medical writers in the mid 19th century wrote about unsanitary practices, which were adopted by indigenous midwives who were known as dyes during childbirth, and they claimed that it increases the risk of postpartum infections. The interpretation of menstruation as a biological phenomenon as well during the Victorian era had little scientific knowledge and more moralistic assumptions associated with women. These assumptions stemmed from Victorian men's ideals of being spiritual and faithful believers, and also from Victorian disgust at the sexual and reproductive processes, which includes beliefs of menstruation as a pathological condition as well. In the late 19th century to mid 20th century, the colonial government aspired to conduct research on the progress of their ongoing and future health interventions. So basically, what their research based inquiries were targeted was to supplement their hopes of imperial claims on necessity of Western medicine in India, but also to highlight the superior systems of engaging with medical knowledge, which comprised of inquiring the most intimate questions about Indian women's bodies and who were being used as template for producing research findings and strengthening their medical systems both in India and in Britain. Next slide, please. So I wanted to talk a little bit about my methods. My archival research was divided into two parts, which started with an exploratory trip, and in which I was just looking at documents which concerned reproductive health care in colonial India, or if there were any mentions of menstruation at all. This trip only focused on at the India Office collection at the British Library and the Wellcome collection, including Women's Library at London School of Economics. And then I had a follow-up trip to that in which I only focused on looking at women's only medical colleges and women's organizations, which were set up by British feminists in India. I have referenced a total of over 60 documents, which include letters, reports, and reports by sanitary officers, and also book manuscripts by British writers. Next slide, please. I wanted to conclude by showing some examples of what the archive documents look like. So, like, for instance, the first example is of a manuscript called Health in India for British Women and on the Prevention of Disease in Tropical Climates by a really popular British physician, Edward John Tilt. The second one is a similar, it's part of Madras proceedings from dated in 1851, which basically talks about the need for a public institution for treatment of diseases for women and children. And lastly, the last example is of the proceedings of Home Department, which basically talks about setting up of Calcutta Medical College back in 1913. In conclusion, this is still an ongoing project, so I welcome questions. And I'm using all of my archival research to sort of build foundation for my ethnographic fieldwork, which begins this fall. Thank you so much, everyone.